For the people that are joining in, it's quite exciting. We have people from all over North America joining us for this webinar, which is great. We're the hosts, Rotsaert Dental Laboratory. We're from Hamilton, Ontario, up in Canada. If to draw an aspect of where Hamilton is, it's basically an hour west of Toronto and an hour west of Buffalo. So it's where it's the most westerly point of Lake Ontario. Hamilton has a natural harbor, and we're an industrial town. My dad started the business in Hamilton in 1964. So next year will be our 60th. So that's quite exciting. And we're a 100-person lab. We do everything, basically everything. And we believe, I don't know if you can read it, as a working partner in restorative dentistry. And what we mean by that is have to have communications to do our jobs right. In that communication part, it's the most valuable and most important part of it. And part of the communication is introducing you to new products. And tonight we're introducing you to the flexTAP. We, as Rotsaert Dental Lab, have been through, I mentioned Dr. Hallstrom, the Hallstrom hinge from Vancouver. And interesting enough, this was in the late 80s, and it's interesting enough, when I think of the Hallstrom hinge, they had a little titanium hinge on the front that you could adjust, unscrew and screw in, unscrew and screw in, but the movement was in the anterior and had this movement like that. And I think what you'll find is some similarities to what this is now, although the design of this is totally different, but I really enjoy it. I think it's a great product. Dr. Carstensen to join us, who is in I believe in Bellevue, Washington, and he's been treating sleep apnea and snoring patients in Bellevue since 1998. He's a consultant to the ADA for sleep-related breathing disorders and heads the ADA's Children's Airway Initiative, which is I think that's a huge part of the root cause of a lot of things. He's trained at UCLA's mini residency in dental sleep medicine and is a diplomat of the American Board of Dental Sleep Medicine. He lectures internationally, directs sleep education at Airways Technology and the Pankey Institute, and is a guest lecturer at the Spears Education in Louisiana State Dental School and the University of Pacific. In addition to advising several other sleep-related manufacturers, in 2014, he's helped found the Sleep Practice magazine and currently serves as chief dental editor. In 2019, Quintessence published a book, Clinician's Handbook for Dental Sleep Medicine, and written and co-authored. The AADSM awarded him in 2003 a Distinguished Service Award. So it's my honor to have this person of knowledge in this world here with us. And along with us is Charles Collins. He's the CEO at Airway Management. He works alongside with Dr. Keith Thornton, and Dr. Keith Thornton, I had some fun conversation with him. He used to go to the LMT lab day in Chicago, and he'd be this guy with this big brim hat there, kind of hanging out at his booth and waiting for people to come up and talk to him. And then once you get him going, you just see his passion and his want and his, it's like this is his baby. And Charles is working alongside of him. Charles has worked in multiple operation roles and learned something new about the business and industry in each position. As the CEO, Charles has created a work environment that encourages innovation and ideas from all team members and continues to help Airway lead the industry in helping most patients with sleep disorders and breathing, including himself. From that whole description and Dr. Keith Thornton and just that brief discussions I've had with him, the flexTAP has been, is a creation of this. Charles wears the flexTAP on a nightly basis. When Charles isn't working, he's enjoying running, home remodeling, and projects, and spending time with his family and traveling. And I think these two people, and also there's Kelly out in the backdrop here, and Kelly McDuff is thank you so much for everything you've done and putting this together. So I really, really appreciate it. What we're going to do is we're going to have poll questions throughout the presentation. There'll only be 4 of them, but this helps us understand where you are on your journey in the custom oral appliances. We have several questions and answers. What we're going to do with the question and answers, Charles and Steve, they're going to be going through the question and answers after the presentation. So keep on asking the questions, and then we'll go through those after presentations.
Well, thank you, Mark. I appreciate the invitation to be here. I'm always excited when we get a chance to tell other people about the value of doing sleep apnea treatment in your offices. Keith Norton was my mentor at Pankey Institute starting in 1989. And so I've known Keith forever on this one and followed him all the way through from many, many iterations of the device. And the flexTAP's like the most exciting one that he's done about that. So I'll be, I hope you'll see the passion I have for this device and this field as we go forward too.
And I mirror what Dr. Carstensen's saying, Mark. We really appreciate you having us on. And Steve, I really appreciate you being here as well, because I'm from the business side, kind of cleaning up the concepts Dr. Thornton has, but you guys in the trenches in the field, really seeing what's working, what's not working. And we thrive off of that feedback that we receive from our customers to kind of continue the innovation. And we're really excited to discuss this flexTAP product with your audience tonight.
So one of the polls is going to be Charles Collins, beard or no beard, I think is going to come up, based on that picture, Charles.
Oh yeah, that's several kids ago.
Serious there, aren't we?
Okay, so we'll jump right into introducing FlexTAP. And by the way, this discussion, it's kind of discussion, but I'll cover some of these key features. But again, feeding off of what we said, that we take the input and feedback that we have from clients. Some of the main features of FlexTAP is we've seen a lot of success with our non-custom appliance, the MyTap. And so we tried to mirror the ease of use, the great patient outcomes, efficacy, and package that in a custom product, because custom is our bread and butter. Custom speaks to dentists. Dentists are the most skilled people to work in this field. And so kind of covering some of those features. The Vertex technology is something that we patented and trademarked. That is, the design of the FlexTAP allows, as the patient is titrating or advancing the mandible, you see the post is at an angle, and it allows, as the patient's forward, they're also opening vertically, and the tongue comes up and forward in that space. So it's a little bit beyond the traditional MAD that you think of. Second to that is we have this new irradiated ThermAcryl. We've used ThermAcryl for years in all the TAP devices, custom and non-custom. The traditional original TAP had this ThermAcryl that was gooey and bulky, but you could always get a ThermAcryl TAP to fit. But again, borrowing what we learned with the MyTap, when you irradiate it, and that's not for sterilization purposes, it's to affect how the plastic flows when heated. It can make it very controlled, an essence of memory to the plastics as well, so it doesn't completely mold into a blob if you don't want it to. And then another main aspect is the mouth shield. We launched mouth shields as a standard accessory with MyTap, and so this is also a standard accessory with this product as well. And that helps with nasal breathing along with other comfort features for the product. And so again, that's included standard with every FlexTAP. Then moving on. Yes.
So let's go back a slide there, Kelly. And I want to say a couple things here to go with that, because we had a question actually asked directly about that. And as a clinician, what I know is that some of my patients have some changes to their teeth from time to time. We put a new crown in, we put a filling in, they lose a tooth, whatever it might be. And one of the beauties of the material that's used for the FlexTAP is that we can reheat that, and not for a whole mouth rehab of a new fit, but a single crown or something that small that's changed. We can just refit the FlexTAP right around that, so it saves a whole lot of chair time, saves a whole lot of expense. It reassures the patient that their investment in a device is going to pay off over the long term. So it's positive all the way around, and all you need is water for that. So it's really great.
Thank you. Those are great points. Yeah, as opposed to some of the traditional liners where you have to really grind in them. Warm water can really adapt. I mean, there's such a blend of science and art with these devices. They have to really grip onto the teeth, but at the same time, it has to be comfortable. And that's very subjective. So for patient to patient, if this is a little bit too snug or a little bit too loose, just warm water and readapting the fit is all that you need to accomplish kind of the perfect match of both. So great point, Steve. I guess we can move on to the next slide on the continuation of key features. So again, as opposed to other TAP devices, is that we've seen or been reported with fewer, faster appointment delivery times, because we pride ourselves at TAP as a range of titration to kind of get any patient to that sweet spot, the treatment position. And with some of the other traditional TAPs, it required changing out parts and hooks, and everything that you need is kind of in this unit. Also, it's the first custom TAP that there are no metal components in there. And so that's a big thing with some people. And because of this tremendous range of protrusion, there's a bite registration is not required. And that's kind of mind blowing for a lot of people. I think any class that I've attended, and Steve, you can probably, you go through how to fit appliances, how to titrate appliances, all that smooth. When we talk where to take a bite, everyone's head explodes. And so we've really tried to simplify this process for the doctors and their patients and the assistants along the way. Currently, the flexTAP offers a 14 millimeter range of advancement. So again, that's a very wide range. Some of the other devices are very large increments. Or every half turn of this dial on the front of the flexTAP gives you 1/3 millimeter advancement. There's a lot of, we'll go into some more details about that. There's also, it's the first TAP that has a standard 3-year warranty for any kind of parts or manufacturing defect. And it is, like all other custom TAPs, it is Medicare or PDAC approved. That's important for us in the United States because usually or typically health insurance follows what Medicare. And so a lot of the oral appliances that are in the marketplace are not Medicare coded. In fact, TAP is the only unique line that every custom product that we have is, again, Medicare coded. Most of our competition have to sell the exact same hardware design to meet Medicare and insurance requirements. So it's another thing that kind of really separates TAP from the rest of the competition sets.
Many of the patients that I see are metal avoiders. You know, they really like the fact that there's no metal on this, especially metal on the side. A super common device that is used that, again, like Charles said, the US is controlled a lot by what insurance covers. And down here, if we have a patient who has restrictions, one of the common devices that is unrestricted for them is a Herbst style design, where it has kind of intimidating metal bars on the side. It's actually a really great appliance, but it does have those big metal bars. And so if we can offer them something that's a really great appliance, but it doesn't have any metal bars, well, that's a big plus for them. And they love that. And when they start the treatment with confidence, because we can say, wow, this appliance is really going to work well for you. And it's going to, and look how smooth it is. Look how there's nothing on the side to bother your cheeks. It's really a big plus for them to feel good about getting started. The bite registration and the range of advancement, I want to say some clinical things about that, because oftentimes we struggle to figure out where is the good starting place. And we don't know where that place is. There's no way to predict that. No matter what anybody tells you, there's no imaging system available that tells you where the effective treatment position is. And that means there's no effective way to know where the start position is. But if you give somebody a device that has a huge range of adjustability, then you can start them at a very unchallenging location. So you don't immediately start with sore jaws or side effects that they don't want. And if you can get them into therapy really comfortably, and then say with, you know, look, you can move your jaw as far as you want because I've got that covered with my device, then they can dial their own jaw forward at whatever rate is comfortable for them. And they're going to find that sweet spot. easily on their own time and without bothering you about it, without having to come in for office visits. It's just way less troublesome for the office to make that happen. But meanwhile, they're comfortable doing it. So it's like a great win here for the flexTAP features.
That's a very solid point. I think you're right that a lot of people get set again on the bite registration. If they can figure out where they think it's supposed to be, and like, oh, this looks like this is a good treatment position. But that's a very big part of oral appliance adoption is, let's be honest, the patient has to get used to wearing a mouthpiece to begin with. And then we always advise, unless they're real severe or something, that you gradually titrate to that sweet spot. The sweet spot is the best benefit, meaning efficacy or treatment wise, with the less stress on the jaw joints, as well as where it's comfortable, where they're going to wear it night after night. So all those kind of things wrapped into one. Great point.
I'm sorry to interrupt. One of the manufacturers told me years ago, Charles, that of all of the troubles that they get on the records that they get from dentists about making these devices, the bite registration is the one that gives them the most headaches. And so to have to be able to skip that, that's another process you don't have to do in the office, another piece of equipment you don't need in the office, and it just makes it simpler. So
again, that's another feature that makes it for a faster appointment or delivery time, because it's taking that step out of the dentist or his assistant or whatever kind of equipment that people are buying to take those measurements with. So it's something that we're really proud of. Again, it's like that it's simplifying it for everyone that's utilizing the device and still delivering great outcomes. And a final point that I didn't see earlier on my screen was that we've priced this to be the lowest custom tap as well. So you've got simplicity and adaptability with the hardware and with the tray system that we've discussed, and you've got a low price custom tap with the greatest warranty that tap offers. So we're very proud to kind of roll this out to you guys, and I think it helps everyone in the sleep care world with a very valid option. So we can move on to the next slide. What makes flexTAP unique? Again, Steve and I can tag team all these points, but if I go back to what really has guided Dr. Thornton in this field was not only creating great products, but also having the research or studies that back up the devices. And so one of the things that we really pride ourselves on as manufacturers is that custom tap, among all the other manufacturers, the majority of our studies are entirely independent. And that's not the case with most of the other people in the industry. And so of course, and also that some of the biggest studies that were done that a lot of other oral appliances use as validation for oral appliances in general. In the 2015 AASN, that's the American Academy of Sleep Medicine, and the American Academy of Dental Sleep Medicine, they put together a guideline for oral appliances. They took out the name of the manufacturer, the name of the device, and they put all the devices that were available. Some weren't even available in the United States. But when we plugged in which devices they were including, TAP really led among all the oral appliances that they included in this criteria that actually helped change the language for even physicians to consider oral appliances as first line therapy for mild, moderate, or for patients that refuse CPAP therapy. So that's a really big kind of groundbreaking thing in the oral appliance world. Steve, do you have any points to add to either one of those?
No, and actually in the 2015 guidelines, when they were published, it takes away any mention of level of disease for oral appliance therapy. You can, those guidelines say a physician can make a determination that a patient can have an oral appliance for any level of disease, not just the mild diseases that was in their original guidelines. And so that drove Dr. Thornton to say, okay, if it's going to be okay to make an appliance and give them to the most severe patients, then we got to make sure it works in those most severe patients. Now, it's not as predictable for somebody with an AHI of 80 as it is for somebody with an AHI of 8. That's true, but it is something that the people will wear. And that's being proven over and over and over again. This research that you see down below, and we have all the papers in the appendix at the end, so you'll have a copy of those. But the research shows that the people that are using the appliances are getting the kind of results that they want. And nothing matters when you have a device that depends on the patient's cooperation. Nothing matters as much as the patient getting what they want. Because we can look at the numbers all day long as scientists, as clinicians, but if the patient isn't getting what they want, they're not going to use a device. So we give them a comfortable device that helps them nose breathe, that is comfortable for their jaw and their jaw joints, and is easy to reset their bite in the morning. And they're going to much more likely use that, which means they have a chance of fixing their breathing problem.
Right, kind of, and adding to these points again, kind of what we talked about key features of flexTAP specifically, but flexTAP is a culmination of all the custom taps and even the non-custom tap, the MyTap I mentioned earlier. And in 2022, I believe, we had a randomized control trial take place in Amsterdam where they compared flexTAP to a custom tap one. That's the original tap that really has the most research on it. And it showed that MyTap, our non-custom, was equal, if not slightly more effective than custom tap. Right. Okay. So how do you have this very easy, not easy, but very non-custom kind of, one size fits all hardware system? And so again, how can we mimic the best features, the forgiving features of MyTap and incorporate it into a custom design that's custom fit to the patient to ensure more comfort, more durability, and professional engagement? And so again, we kind of copied that the flexTAP hardware mechanism is really taking in the this ACTA research that was done on the MyTap and continuing that. And the mouth shield or the nasal breathing trainer that we're proud of, we were using that with MyTap and in a small trial that we were doing at Texas A&M Dental School here in Dallas. They were treating patients with MyTap first, or in some cases first, and then they would switch up using the MyTap with the mouth shield, and it proved that the patients were better treated with when they used the mouth shield. And that's a huge thing going on in the greater health awareness, is that nasal breathing is the way we're supposed to breathe. And TAP is really the first custom oral appliance to really incorporate this as a standard accessory, custom made to fit with this device. That not only helps with the outcomes that we've discussed, but also kind of as a comfort accessory for excess saliva, dry mouth, and even to kind of overcome that post that is unfortunately is kind of a visual pain point, but that one post allows for all the simplicity we've discussed and some of the better outcomes with this device itself that we'll discuss as we go down. Okay. Oh, and so we talked about the Vertex technology, and Kelly's playing this video right now, that kind of graphic video that shows what happens with the flexTAP. So that, again, this post is bent at a 45-degree angle. As the mandible comes forward, the tongue comes up and forward too. And as opposed to all the more legacy taps, the hardware was tethered in the anterior, but the tongue could only come as far forward to where the hardware met. And so in this case, the hardware is tethered outside of the mouth. And so it allows for much more tongue space to come up and out of the airway. So again, kind of copying mandibular advancement devices, and maybe even some aspects of like tongue retaining devices where the tongue came up and forward to clear the airway. This is something that we've seen that we're working to put together some papers to show side-by-side comparisons of patients that have used legacy taps and flexTAP. Again, Dr. Thornton has shown many of his patients being treated more effectively with less protrusion or less stress on the jaw joints, partly because of that design, but also because of the use of the mouth shield.
So if you have a patient who has a restricted jaw arch length, and so you know that they don't have enough room for their tongue. In fact, you look in there and tongue has been all squished up against the lingual surfaces of the teeth to the point where they have those little indentations along the side. What you can be confident in is that that tongue is looking for a place to go. The genioglossus is trying to push that tongue out of the airway so the patient can breathe. So you give them a smooth device that gives them more tongue space. The muscle function of that genioglossus is still working. So it'll push the tongue out of the airway and you'll have more effectiveness on the airway. Now, do we have science that proves that yet? No, but what we do have is just good clinical observation now for quite a while. And I love, this is my go-to appliance for patients with that indentations on the side of the tongue, which is a lot of my patients. So just for that very reason.
And this is another point about the Vertex technology. Again, we've discussed it. It's opening again. It's kind of simultaneously moving horizontally and vertically. In that, so we're seeing again patients that need less protrusion with better outcomes, and that eases any potential side effects of or strain on the mandible and less tooth movement. Yeah. And kind of re-hitting on these points again with this new ThermAcryl liner that Steve and I have kind of been hitting on. So it's thinner than all the traditional tap liners, traditional or legacy custom tap liners. We're even working on pretty soon an even thinner liner for this one will be available before the end of the year. It's more durable. And again, we talked about it's easier to adjust chair side using warm water. And I mentioned earlier, we've used ThermAcryl for years in our custom taps. With some of the older taps that were not irradiated, you had to, as a doctor, you had to gut this thing out once a year because the material would start to break down. And with this irradiated ThermAcryl, we've seen great durability. We've used this irradiated ThermAcryl in the in AccuTherm, which is a similar liner, in the MyTap again, and now with this FlexTAP as ThermAcryl standalone, and it's very durable. The good thing is that if you need to add a little ThermAcryl, you can heat that up and put a little extra material in there if that would come up. But yeah, AccuTherm's been on the market for 4 years and seems to hold up very well. And so we think this, same with MyTap, has been on the market for 10 years, and that that really makes these trays very resilient.
Okay, before we go to the next slide, could we do another question, please?
Great.
Sure. You want to do a poll? Yeah, there we go.
Yeah, poll. This one's a quick one, so I'm sure we'll wait sooner. Could you also comment? There was a question that was asked. My patient's getting a new crown. You know, can this be adapted to this? Can their FlexTAP that they have be adapted to that crown?
Yeah, just with warm water. All we do is the patient can do it. The dentist, in my practice, I don't do any restorative care anymore. So the patients are getting crowns from their primary care dentist. And so that dentist can just warm up the tap and fit it in, you know, put it in and out a few times and it's fitted. That's it. The patient can try that too, and because they can't ruin it. The only way they can ruin a MyTap or FlexTAP is to boil it. And they're not going to boil it. So they just heat it up a little bit and put it in their mouth, and it fits really nicely. It's really great that way. And Charles, there's no BPAs in ThermAcryl, is there?
No.
Yeah, I didn't think so. Yeah.
And I saw a question pop up. Mark, do you want me to answer these questions now, or kind of wait as we go? Or you
yeah, let's answer them. You know, if you see a question that's pertinent to the what's being shown, and you think everybody to share that, for sure, let's go for it.
Dr. Shah says, this seems like a boil and bite. Okay, yeah. It is not a boil and bite. We do have a boil and bite MyTap, but it's not. It is custom formed in a dental lab over either traditional stone models or digitally printed models. The plastic is vacuum formed, and so it's not a boil and bite. It kind of utilizes some of those forgiving characteristics, but it is custom fit to the patient. And the material life expectancy, I think I referenced earlier, is at least 4 years. I mean, I'm sure somebody's really heavy Brux or something like that, it could go out before that. And we've seen even on the MyTap, that's a thinner tray, that is a boil and bite, that they've lasted in some cases 5 years. So we're pretty secure in the longevity of this, and that's one of the reasons we've given this a longer warranty period.
So Charles, on that note, what is the patient care for these? Is it just rinsing under
Rinsing under cool water with a toothbrush. Periodically, you can use toothpaste, begin rinsing. And we are testing right now some high in acid kind of cleaning solutions, because we have had some feedback with this blue liner that while it hides funk, it can show calcium deposits. So we're looking, but that would be done probably once a month or something to that effect. But I think that will be, all the testing is looking very positive, but I think we cleared up before the end of this month, honestly. So
we just recommend people use their toothbrush and toothpaste on it, and then also because also denture cleaner, and we like one called Stain Away Plus, but I'm not tied to any brands here, but those things work great on these on FlexTAP material. So something you guys should know is that Charles can only say certain things because of FDA clearance, but I can say whatever I want because I'm a clinician. So I can say toothpaste is fine, but you can't do that from an FDA standpoint.
Thank you. So that's why we have to tag team this. So
right.
So Mark, do you want to move on? Do you want to keep answering questions? We're here to.
Well, let's answer some questions right now. Okay. Can you order this from Canada? I'll answer that one. Yes, we Rotsaert Dental Lab is selling the FlexTAP, and you can order it directly from us. Not a problem. And is there any ones? Let's take the one of the original ones is my patient. Where was it? It was with the crown, and also there was a second question concerning that patient also.
Yeah, that was Stanley. We answered that question for
Stanley.
Okay.
Okay, perfect. And the one at the bottom says, how do you adjust the vertical for this?
Well, you don't really need to, because it's got the Vertex technology. So as you go a little bit further forward, then the Vertex technology brings the jaw down. Think about the anatomy of the condyle against the glenoid fossa. We have that slope of that fossa anyway. And so the angle of the protruding element there is set to, get closer to that, closer than any other device. Every other device is straight horizontal. So this one matches that. And as the condyle comes down the eminence, it has less rotation necessary because it's just staying with that same vertical. So it's more comfortable that way, less stress on the parts. And so we don't see much trouble with that in our practice. I give these to bruxers because it's flexible. And when I know this from my personal experience, I'm not a bruxer, but when I put it in my mouth, what happens is, because it has this Vertex technology here, I'm going to try and make this work because I don't think Kelly has an animation of this, but it kind of is springy like that. And as it's springy, it feels better in my mouth. It's more, parts move better than they do with a rigid device. And all these parts are meant to move a little bit. And so as it moves a little bit in my mouth like that, it feels comfortable, but it springs me open a little bit. It makes my teeth come apart a little bit, which is not forceful. So it's not like stretching all the parts, but it just allows that maximum opening that's comfortable, and that gives me more tongue space. So that's that part I like about that. And they ask about the nasal breathing trainer here, and it does have little tabs that go in between the arches. And so that's another thing that as they bite down on, they squish into those little tabs, and that supports the extra muscle activity without being rigid. And so if you have less rigidity, then the muscle fibers won't fire as much. If you give them something to push against, like a hard surface, then clinchers will clinch. And so if you give them a softer surface, they'll chew on it a little bit, but they don't destroy it because it's just against the FlexTAP material. And if they do, we'll just give them another mouth shield. So that's not a big deal. but they will also not feel that rigid, let me push against that from their muscle fibers. It's a whole neuromuscular benefit that way. Now, again, guys, do I have science behind everything I just said? I don't. I haven't done like EMGs or anything like that on these patients. I'm just reporting what they tell me, and I'm, been around enough that I know what questions to ask. And so that's all I got. That's the clinician side of things, not the scientist side of things. So don't to take it from what that means.
Okay.
So that help,
Sure.
Charles?
It
Sure.
did help. Do we need to keep moving, Mark?
Well, there's this one question about the mouth shield, and seeing that we're showing this, somebody says, I found it very difficult to insert the appliance with the mouth shield in place. Any advice?
Steve and I help. Again, I wear it, but it's for what I know, most people just slide it over the front and insert the device as one.
Yeah.
That's another kind of benefit of this post design as opposed to some of the other taps that had mouth shields where it's kind of the post acts as a handle. So you just kind of put it on and then tuck the flanges of this behind the lips. But another thing is that these flanges can be trimmed down as well. I've trimmed mine before these posterior pads that Steve was referencing earlier, where it's just covering right where my lips are slightly open with the device. So that's another thing is that these are customizable. You can kind of trim them down based off of patient's lip opening size. But I don't know. Do you have any other pointers there, Steve?
Well, I can say that if a patient wants to, what they can do is they can just place it over the post, put this part in the mouth, and then just tuck this in the way, in under their lips. I frankly would just let them do it the way they want to do it. I think most of my patients do this. They put it all together. That's how I put mine in, and I just put it all in and I kind of bite into it and kind of works. It's pretty easy. I do run mine under warm water before I put it in my mouth. It makes it a little easier to tuck over the teeth, but you can do that. Don't have to do that. That makes them a little more comfortable. But that's how I put mine in. But I guess you can put it any way you want. Yeah.
Okay.
I had one patient try without the nasal breathing trainer. They couldn't really tell much difference because their lips come together anyway. And so I said, I'm not going to argue with you. Just, if you're going to use it, I'm good. So.
And kind of going back to the acclimation period, I've had some doctors say they like the patient to get used to the mouthpiece itself first and then add the mouth shield, but it's kind of, it's about kind of, I think, giving the patient the options. And now that I've been wearing a mouth shield, I can't imagine going back without one. You wake up every morning with, again, this is personal experience, no nasal blockage whatsoever. Your nose is open. There's never any drainage. It's incredible what mouth shield or something like taping can do for your nasal passages.
We do add a little bit of saline spray to go with it. I won't say the brand because it's not appropriate, but a little nasal spray, and that helps clear the nose before they go to sleep as well. Let's keep moving, Kelly.
Yes.
Well, there it is.
We've hit that point. The post pads, we hit that point. That is on the mouth shield currently. And then kind of covering the benefits to everybody. From the clinician, we talked about there's a shorter delivery time because there's no bite registrations. There's no purchasing of those tools to do that. There's a shorter delivery time, and the fact that you're not changing out hooks and different hardware pieces. Again, it's the lowest price custom tap from a doctor's perspective. There's fewer in-office fittings because of that range of protrusion, adjustability, and so those are some of the key benefits to the doctor from the lab. There's a little bit shorter fabrication time. There's no metal parts, and that all the kind of customizations are standard with this device. So there's fewer hardware customizations that we have with some of the other devices there. And then for patients, there's predictable outcomes. The 3-year standard warranty that kind of I guess affects everybody in that list, and that there's this wide range of self-titratable advancements. So,
Okay. Well, I'll speak to this one. to use it from Rotsaert Dental Lab and other affiliated labs in the States, by all means. What we require is an upper and lower impression, either an oral scan or a traditional PVS. Obviously, the impressions need to be accurate, full arch impressions. I'll ask the next question about semi-edentulous or edentulous patients. What do you do with them? And I wrote down here bite registration, but as I put that in because people want to give us a bite registration. When you're setting this up, there was a question about where you're putting the bite, and it's how much. The question was how much vertical at the end to end bite do you want to start with, and maybe we'll talk about that later, or just after I finish. Just send your scans to Rotsaert through whatever connection you have. We have it on our website. We're asking for an 8-day turnaround for the delivery of the flexTAP, and our price is $430 Canadian, and that includes one AM aligner. And I believe we're going to be talking about the aligners. I believe it's an important step in all treatment. So let's go into this. Then after we discuss this, let's go for another panel question. Okay.
So this, guys, I'm a clinical education guy for Airway Technologies. Keith Thornton's been my mentor for 30 some odd years. This is my favorite thing he's ever invented. The AM aligner, the new one like this, is just incredible. And every device that you ever put in a patient that moves their jaw forward should come with a way to get their parts back to their normal alignment. Because you think about it, you pull the condyle out of the center part of the fossa, and the body adapts. It can do that just fine, but you keep it there for several hours, and what's going to happen is your parts will take a set, as it were. There, it's kind of like sitting in one place for a long time, and so you have to get those parts back to their normal configuration, or else the teeth won't come together. If you allow that to happen over and over and over again every night for some time, then your body's going to readapt, and it'll maybe prevent those teeth from coming back together. And that's true for every single device out there. There's nothing unique about moving the jaw forwards effect on those parts. So you think about what a flexTAP can do. It allows the parts to move, so that's going to be less rigidity for those for them to take a set. And then if you give them an AM aligner like this, it guides the jaw very gently and easily back to where it came from. Then the patients that I've had over 20 some odd years that are using their AM aligners in whatever configuration we've been able to have, they don't come in and show me changes in bite. The ones that change their bites are the ones that don't use the AM aligners. So now we've made it much easier. So you heat up this little wafer full of ThermAcryl, and same irradiated ThermAcryl. You put it in a little bit of warm water, you put it in the mouth, you have them bite together in MIP as hard as they can, makes clear spots in it. That's exactly what you want. And then it cools down. And when they put it back in, it feels right. And when they put it in the morning after their jaw's been forward for a little bit, they can feel it doesn't feel quite right, but they can put some pressure on it with their chewing muscles, closing muscles, and little by little, their jaw guides back to the normal place, and they can look in the mirror, and there it is. It's all lined up and perfect and feels right, and and they're on with their day. And so this is the easiest thing that's possible. It's got that little handle on it. I kind of like this device, Charles. Thank you.
Thank you. And again, that comes standard with every tap device and flexTAP as well.
Yeah.
Okay.
Okay. We had in the chat room, we had somebody asking if there's no bite registration, then from what point is the 14 millimeters of the protrusive in reference to, and how can I be assured of those 14 points? And we have another questionnaire also as you answer this.
Yeah, go ahead and answer your level of expertise. But the number that you have for the protrusion is not near as important as the feedback you get from the patient and then their subsequent testing if it's important for that case. So to be able to register how far forward the jaw goes is not really as critical as it may sound like it is. because it really doesn't matter until their symptoms are done. So you're not going to give them a goal that you must get to 7 millimeters or 3 millimeters, because you have no idea where their place is going to be. So the first goal is to get in the mouth and get them using it. That means we can give them in a comfortable place, which generally in my office, when I've been taking bite registrations, is about half of their protrusive range they show me. But you can start them at end to end if you want. You can just say, you don't even have to have one with this one. So you put it in the mouth and go, dial this forward until you're comfortable, or keep it where it is. And then what you're going to see later on, Charles didn't say it because he doesn't know the timing of it all, is that there's actually more of those adjuster posts coming that'll give you even more range to use. So you have plenty of range on this one. I wouldn't be too worried about being precise on where they fit or where they go to. What you want to do is focus on what benefit do they see from putting their jaw in whatever position they dial it to, and then you do some objective measurements to see if their numbers are correct as well. So it's not as critical.
Great points. And again, with the Vertex, the vertical opening simultaneous with the horizontal, again, we're seeing that it requires less protrusion. So when we say 14 millimeters, there's 14 millimeters of travel on this adjuster, on this threaded part. So you're right. In some cases, I'm sorry whoever asked the question, but that doesn't necessarily mean you've got 14 millimeters of pure advancement. It could mean for some patients, it's a little retrusive. You got 14 millimeters of total range of adjustment on that adjuster. And as Steve referenced, there will be, before the end of summer, there will be actually 17 millimeters range of adjustment. And that adjuster is made to be interchangeable so that as we kind of continue to innovate, that you can snap different components in there. So.
Okay. I got this question is FlexTAP is the anterior disclosing element like an NTI, and then the other question or the other comment with that, with the clenching patient, should I remove the horizontal tabs so she won't continue to clench during sleep? These tabs would seem to eliminate the NTI effect. Can you?
Well, we don't have time to get into all the details of that one, Mark.
Okay. Yeah.
The short answer is, as a clinician educator, I don't really believe in the NTI effect of oral appliances. I believe in the NTI effect, but not when there's a whole arch of device there, for one thing. That's my differential, and you may disagree with me, which is fine. We don't have time to talk about it.
Yeah.
And then the second part is that I find those little tabs in the back to be protective of the folks who are grinding, because it levels out the pressure on the system. So it gives them a chance to have something in the back which is more closer to underneath the muscle force as opposed to in the front. And so it's, I think, protective. But you know what? They're removable. So you can cut them off if they don't like it. And if they cut them off and they like it better with them back on, you give them another mouth shield. It's pretty straightforward to experiment and stay with your patient as you discover what's the right solution for them.
Okay. And another question was, other than patients maybe objecting to the protruding post, what contraindications are there to using this appliance?
I put this in and I say, you look at the post sticks out the front, and they go, yeah, that's kind of weird. And I said, yeah, it's others don't do that, but try it, see what you think. And nobody comes back complaining about it, especially what one of the slides said, that you can cut off the extra bits right here. And when you do that, this is real smooth across the front. So it's not really much of a problem at all. I mean, they're doing something to make themselves quiet, to solve a social problem, to solve a medical problem, to wake up feeling refreshed. And the worst that they can come up with is that they complain about a little soft silicone post out their mouth. It's just really not a big deal. It's not, it looks like a big deal. And Charles, what did I say the first time I saw one of these? So I thought it'd be a big deal, but it's not.
It's a visual barrier, but again, all these things of the range, protrusion, the no bite registration, the tongue space. Again, no other hardware will allow, as you go forward, for the tongue to come up and forward into that space, and that adds to some of the vertical dimension there as well. The tongue is coming, as I said, up into the space as well. Kind of that graphic design showed that earlier, but and with the mouth shield. So you've got a visual kind of barrier, but when you understand, you kind of feel all the other benefits. And the numbers don't lie that we're seeing with patients in comparison to other taps. So, but I will, yeah, I admit that is a thing to overcome, but the ease for everybody else in kind of acclimating to it certainly outweighs that one little visual thing. And another thing is that this looks big kind of outside the mouth. When you put it in there, it doesn't even stick out as far as your nose, much behind your nose even. So
Yeah.
Okay, and Kelly, can we go to the next slide, please? And then, okay, and then I added on, did you add on those others? Okay, so one of the questions is when and how do you test for a sweet spot? And this is something that I just put up. I've been talking to this company, and it's a portable lightweight device for on your index finger for transmitting data wirelessly for fast reporting. This is FDA and Health Canada approved. This product is shipped directly to the home patient, so they wear this on their finger, and it just, and I don't know, Dr. Carstensen, if you could comment on these types of devices or for measuring or for testing at home, or do you know about this one at all?
I know about this ring very well. I'm not sure if you're which company you're referring to, because that's a data collection device that's extremely high quality. And then several different companies use the data in different ways that come off of this particular device. Do you have a company name that you want to say?
If we go to the next slide, I believe there's a code there. Do you have that next slide? There we go. So this is M Health Solutions is a provider of this in Canada, and and they're working through healthcare professionals and hospitals throughout Ontario and Quebec. But I don't, I have tried this at tested, and what I did is I did one night without and one night with a sleep appliance, and and it showed those different ranges. So this is, I don't, that's me just testing it out, saying, hey, this is a neat way to go. But I like some comment on that one. But right there, if you scan that code there, you'll learn more of this testing thing, the testing device.
Sorry, Mark, I'm not familiar with M Health, so I can't speak to that. But
yeah, they're a Canadian company, so
that ring device though is a very high quality device.
Yeah, and I'll send you the information from them tonight also. I just put this in last minute because I just had this conversation with this person today, and I said, you know what, I'm giving a presentation tonight and I'll just throw it in quickly. So I know some of it, but not much of it. So, I just thought it might be of some interest to some of the participants. Kelly, if we could go right back to the slide saying thank you. And my watch says about 4 minutes to 9. So I think that it's a good time to leave. If any of the questions haven't been answered, and you can keep on at, oh, here we go. Well, this is the last panel. Good. Thank you, John.
And there's my email address, guys. I love to get clinical questions about this. And if you send me a question, it's a Charles question, I'll send it to Charles. He'll answer it for you. But if you have a clinical questions, please send them along. I love it. That's what I do.
And also, you can if you want to, you can send it through me, and then I can forward it to both Steve and Charles. That's not a problem.
Yeah, if this is recorded, I thought that maybe we could follow up, Mark, with any kind of questions that
what we could do is we'll go through all the QAs of the QAs. We'll type them out and we'll send you guys the questions, and you can answer them as deep or what you would like. I think that'd be great.
Sure.
This is being recorded. Everybody that has registered, we have 52 participants. We have over 100 people that have registered. Everybody's going to get this recording. And I think that's a great value for people to look back at and get some information. So again, Steve and Charles, thank you so much for doing this. And you know, it's a great way to introduce this product. And I think it's we as a dental lab are looking forward to offering this to our customers for their patients. And I think it meets a great point in the market. And I think it's fabulous. So thank you to everybody. And Kelly, thank you. And behind the scenes on my side is John Dickinson and Jen Rev. Thank you so much, guys, for helping out and promoting and putting this together. So we really appreciate this. And maybe what we could do is work down the road for a part 2 on this and go in a little bit of a deep dive with some of those questions that were asked. So I really appreciate this. So
thank you, Mark.
Everybody have a great night and take care and enjoy tomorrow's first day of summer. Okay.
Bye now.
So take care, guys.
Y'all.
Bye now.